Welcome to my podcast. Today I'm going to talk about another common case which affect 1 in 200 and usually seen in the UK. So basically, after the patient came to you, you introduce yourself as always agreed, double patient-to-patient name and date of birth. You'll ask the patient, how can I help you today? So the patient might be aware, or in certain situations or occasions they wouldn't be aware. So I'm going to talk about a case that I just come across accidentally, and I thought to throw some insight which could help in one way or another. So it was about a lady who had obviously a history in the family. That her mom, she has a history of bipolar, and the lady seems to have a milder form. So the lady said that she's aware of her situation, however, her mom is not. And basically, it's a condition, as we all know. It's a mental health condition which could affect the mood, and where the mood can swing from mild to extreme situation. So the patient might feel very high, might feel very energetic, might feel that she's full of energy, she's not able to cope with the slowness around her. She wants to pace things and very fast. And in other situation, she might feel, or the condition might feel that feeling low, lethargic, not in the mood to do anything, just want to stay home, stay in bed, watch TV, maybe not eat or not doing anything, not in the mood even to talk or any of that. And basically in those kind of situations always flip around, so it could last one situation like 2 months, but can't be more than that, and then it will switch to the other extreme situation whereby the patient might talk very fast, quickly, and get annoyed easily, maybe feeling very happy on the moon, lots of energy, ambitious idea, ambitious plans, want to do things at fast speed, at fast pace, and then flip around to the opposite situation. It has been found that 1 to 100 in 100 people can be affected. They could find that most of the causes, and my lady, she used to say that she left a stressful situation, busy. So one of the causes can be extreme stress, extreme strain, overwhelmed with a lot of things around. Could be lifestyle event, and the most well-known another attribute can be a genetic issue, or changes in the chemical factor around the brain. So in that situation, we all know that we need to talk to the patient, try to address their main concern. If the patient aware of the issue, they can talk freely about their main issue, address their concern, their idea, their thoughts, because sometimes they are aware of the issue and they have their own insight. Or if they are not, I'm gonna ask if they were escorted by someone. What's the main thing that's worrying you, and if you notice that it's affecting your life, affecting your daily activity, you just need to try to address all of that. And then, as we all know, we need to pass through the past medical history if there is anything that's relevant that we need to know, if there is any medication being taken, and if there is any history of allergy. And the other point is the family history, if there is any family member who is affected with the same situation in any way. And of course the lifestyle of the person, what sort of activity they do, what sort of a diet, what sort of lifestyle in terms also of smoking, drinking, and social engagement, and their social situation, whom they live with, and if they are able to look after themselves, and job-wise as well, is very important to address. So when we address all of those points, we just talk to the patient. What would you expect me? What would you expect in in this consultation to see? And maybe the patient they have their own thoughts, how they can be helped, and then you will just agree about the management plan between patient and the doctor. So you could talk about, of course, if there is any thoughts the patient might have. So maybe patient they have in their mind that they would like to try talking therapy. So it's basically psychological treatment. So it's called CBT, which is cognitive behavioral therapy. So the patient might be interested to try that before going to any medication. Also about lifestyle advice, try to tell the patient to have some regular exercise, walking as well in the field. Try to appreciate and observe the nature around, listen to the bird, watch falling leaves from the tree in winter time. And if they have any planning activity, for instance, or if they have any sense of purpose, if they are doing something that they feel passionate about, if there is any achievement they have done so far and they are passionate about as well, and try to get also enough sleep. So try to have a strict sleeping routine, which is called sleep hygiene. So try to go in bed at the same time, wake up at the same time. Try to, sometimes some people, they have a lot of things going on, kids, work, family life. So try to organize things in an orderly manner, and see how it works for you. And sometimes also you need to tell the patient about self-help and learning, because everyone is unique in their own way. So maybe what's work for this person won't work for the other one. So there is a lot of leaflet, a lot of knowledge that can be found in the internet, whereby you see what works for you and try to read about it and try to adopt the situation accordingly, because always we need to self-help ourselves and no one will help you, basically, in any regard. So it's always any person he's the doctor of himself, so he can know what works for them and what doesn't work, and from there you take it. And of course, there is a lot of support group whereby the patient can sign up and share some experience, some thoughts which could help, and try to find you're passionate about anything and try to indulge in it and try to engage with that. My patient, my lady, she said that she liked to help refugee groups, and she found herself in that. And also she liked theater, so that's another passion she's doing. So it's just finding a way how to live and carry on with your life. And of course, if all of that did not work, and according to the situation, if the patient, for instance, is having too much symptom which is affecting them, they need to take medication. So maybe the doctor can give mod stabilizer in order just to calm the situation a little bit. And certain situation, if the patient have some psychosis or hallucination or any of that, because sometimes things happen, you need to think about what sort of antipsychotic you can add, and of course check on the patient and make sure that it's working, and warn the patient about the side effect if there is any, just to bring to their attention. There's another form, which basically a milder form of bipolar, and it's called cyclothymia. So it's basically a milder form, and it's breaking down with a period of normal mood, and it can't go longer than 2 months actually. So the patient might experience low mood at certain situation, emotionally can be high in others, and just need to treat it accordingly and try to address the patient's main point and main concern. And there's always, you can guide them through the support group. Like, for instance, there's some which is linked to bipolar, like Bipolar UK. There is the Mind as well, which is taking the big chunk now about the mental health condition and disorder. And there is another one called Rethink Mental Illness Solve that can be a sharing experience in regard whereby it could help in one way or another to tackle the situation and just bring it under control. And always safety net the patient if anything doesn't seem right at any situation, or if the patient feeling complete depression or maybe have any suicidal thoughts or ideation. Always signpost them and give them, give them the number whom they can contact, and always tell them if at any situation you felt that you can't cope anymore, just come back to the GP or go to the A&E immediately, and things will be sorted according to the situation. So by that, I hope that I covered what's meant by bipolar and cyclothymia and how you can address them from different aspects. And another thing before I forgot, that you need to inform the DVLA about the situation, because if the patient is driving and might have certain situation at that moment, DVLA need to be informed and acknowledged about this situation. Thank you.